Hi, and welcome to our presentation, Collaborating with Community Partners to Develop a Harm Reduction and Stigma Curriculum. My name is Saundra, a primary care provider in the San Francisco Health Network and curricular lead for this project.
I'm Jar-Yee, and I'm a first-year medical student at UCSF.
Hi, I'm John.
And I'm Seth.
And we're health educators with the Syringe Access Services Department here at the San Francisco AIDS Foundation.
We'll be your presenters today, and also wanted to highlight some other key members of our team, shown here. By now, many people are familiar with the opioid epidemic. Over the last few years, there have been sharp increases in mortality from drug overdoses across the nation, driven by the introduction of fentanyl into the drug supply and made worse by the COVID-19 pandemic. In 2019, 441 people died of drug overdose in San Francisco. This number rose to 700 deaths in 2020 and continues to rise rapidly. In response, a pilot was launched where community primary care clinics were identified as sites to distribute intranasal naloxone and safer consumption supplies to at-risk patients, with the goal of preventing overdose deaths, increasing safety around substance use, and access to harm reduction services. Our project aimed to develop a training curriculum that would educate providers and serve as a foundation for these pivotal patient interactions. When we were initially developing the training, we were focused on thinking about how frontline staff could be trained on how to use intranasal Narcan and the safer consumption kits. However, our community partners at the SF AIDS Foundation, with their experience in serving the community and their own lived experiences, said, that's the easy part, to teach that stuff. What's hard is addressing the main barrier for people who use substances, and that's stigma. And stigma starts way before the clinic encounter. It starts in the waiting room, at the front desk, with the environment. Then there's stigma from others, clinic staff, providers, and then there's self-stigma or internalized stigma. And all of this serves to keep people away. And there's no point in having all these supplies and services if your patients can't access them. We need to address stigma. So we developed a training with 3 components, with the harm reduction and addressing stigma session as the foundation, followed by an overdose prevention and intranasal naloxone module, and videos created by the SF AIDS Foundation reviewing the safer consumption kits. One thing that was important to us was including the voices of people with lived experiences as experts in their own care, both in the development of the curriculum and through the power of sharing their stories. The Harm Reduction and Addressing Stigma session is a guided discussion-based session that is conducted at each pilot clinic site. We talk about basic harm reduction principles, the effects of stigma, and how we can address it. We also learn and hear from our community members who share their experiences with stigma and harm reduction. The training provides a safe and protected space to start a conversation that we hope will continue long after the training. Before the training, we meet with each clinic site champion beforehand to discuss the specific educational needs for their clinic, and then tailor the training accordingly.
About our overdose prevention or Narcan module, it was built using Google Forms with material provided by our collaborators at the Dell project, supplemented by video narratives and interviews shared by our community partners at the SF AIDS Foundation with lived experiences of responding to an overdose. The module is super interactive with questions scattered throughout it, and it's pretty simple in terms of its learning objectives. It goes over how naloxone works, when to use it, or in other words, how to identify an opioid overdose and how that's different from being high, and how to respond to that overdose in a way that's really trauma-informed. So using the Narcan, calling the emergency services, etc.
We recorded these videos on safe consumption kits and fentanyl test strips to explain supplies and how to use them.
We asked other health educators with the Syringe Access Services Department here at the San Francisco AIDS Foundation to record these videos. These videos are designed to educate providers and other clinical staff on substance use and harm reduction to break the barriers to stigma so that substance use can be talked about openly and honestly between patients and clinicians in clinical settings and improve health outcomes for all involved.
In terms of evaluating the effectiveness of our harm reduction and stigma training, before the training, we have participants complete a survey that tells us to what extent they interact with people who use drugs, as well as their levels of drug-related stigma. Post-training, we assess changes in that drug-related stigma, as well as changes in people's perceptions and practices around harm reduction. That's all we got for now. Thanks so much.